My name is Elena Sperk. I'm an assistant professor here at the Mannheim Cancer Center in Germany, and I work now since more than 15 years on the topic of intraoperative radiotherapy in a special circumstance of breast cancer, and I'm a radiation oncologist by training. The study Target BQR is a study which is a registry. So it was designed for quality control because IORT as a boost is already done within in the German guidelines, for example, and also within other guidelines, and is one option of intraoperative treatment for giving a boost. And this special treatment is one option of having a boost, but it's done intraoperatively. A Target BQR is a study testing intraoperative radiation therapy in breast cancer patients, which have really a high risk of a local recurrence. And here, the boost means that we give additional radiation dose to the tumor cavity for getting higher control rates regarding oncological outcome. And the IORT is only one option of more options which we can use to apply a boost. And our registry study was now a study to collect all the data of patients with high risk having this IORT as a planned boost. So all of them had an intraoperative radiotherapy during surgery and immediately after resection of the tumor. And then afterwards, we added a planned whole breast irradiation, which was kind of package for radiation treatment for these high-risk patients. The study design is a register study, so we did not have a certain protocol, but we registered patients who were prospectively assigned to the study and gave their informed consent to participate in the study and to share their data on this kind of treatment and their follow-up. So it's kind of quality control in that. And it's also a real-world setting because we did not really exclude patients to certain factors. The only exclusion criteria were tumors bigger than 3.5 centimeters because our method can only cover small cavities up to 5 centimeters. And all of them had to have an indication for a boost prospectively and to give their consent. The results were that we saw all over an excellent outcome for oncological aspect. We had a local recurrence rate of 1.1% in the end 880 patients. So we had really a large cohort with prospectively collected data. The median follow-up was 32 months, and as I already mentioned, all of them had a high risk for having a recurrence. And in the end, we saw only 10 patients with recurrences after 12 to 55 months. And this ended up in the Kaplan-Meier estimate of 1.1% during the whole follow-up. Additionally, we saw 2 patients with ipsilateral breast carcinomas out of the index quadrant. We had only 3 patients with contralateral breast carcinomas and 2 patients with axillary recurrences. And I repeat it, we had 880 patients, so 2 and 3 is really a low number of such recurrences. Additionally, we saw only 14 patients with metastasis. This ended up then in a Kaplan-Meier estimate of 1.6%, which is below the rate that we expected in such high-risk patients. And in the end, this also ended up in a very good overall survival of having only 16 deaths. And this was a Kaplan-Meier estimate all over the whole follow-up of 1.8%. So a high rate of overall survival with nearly a 100% in this high-risk patients. I think this really underlines the quality control of this kind of boost method. And this, I think, widens the portfolio of options for shared decision making. So if patients really desire to have a quick and safe treatment, IORT Boost is really one method they can choose because it's a one single shot treatment, and usually all other boost forms like brachytherapy or percutaneous boost methods need a longer time frame. So this is a very fast and also safe treatment.